Welcome to the Kentucky Education and Labor Cabinet Office of Occupational Safety and Health online training resource. Today we will be discussing mold awareness. This course is presented as a service of the Division of Education and Training. Please pause the presentation and read this disclaimer. When you are ready, press play to continue. In this webinar, we will discuss what mold is, the health effects of mold, how to recognize mold, and how to prevent or clean up mold depending on the circumstance. This webinar goes hand in hand with our flood prevention webinar that can also be found on the KY Safe e-training website. What is mold? Molds are microscopic organisms found everywhere in the environment, indoors and outdoors. In large numbers, mold spores may potentially cause adverse health effects. Mold growth is common after flooding events, and it is important to remember that mold tends to grow in damp areas indoors. When flooding occurs, mold will attempt to grow where water damage has occurred or where dampness has been allowed to persist. This dampness does not necessarily have to be where water flooded into, but potentially in an area where water vapor has aggregated when floodwaters recede. It can also occur in areas with high humidity, hot weather, or differences in temperatures between substrates. In the photo on the slide, we see mold growth on the ceiling and on the wall of different buildings. The mold growth on the ceiling likely occurred from persistent dampness from a roof leak. If persistent dampness can occur in the ceiling, it can certainly occur behind or in walls, behind wallpaper or baseboards, above drop ceilings, insulation, and in crawl spaces that flood water has affected. The health effects of mold exposure tend to mimic symptoms of other respiratory diseases. Some of these health effects are sneezing, coughing, and congestion, a runny nose, aggravation of asthma, eye irritation, and dermatitis, commonly known as a skin rash. Since the health effects of mold are similar to other respiratory diseases and allergy symptoms, many people overlook mold as being a potential cause of their symptoms. Millions of Americans are affected by mold growth in their homes and workplaces every year, and many of those affected may be unaware of the mold causing their illnesses. Mold typically thrives between 60 and 80 degrees Fahrenheit, which is the typical climate range for a home or a workplace to be kept at. Floodwaters and dampness, along with the indoor climate control of buildings, establishes the ideal environment for mold to grow. It is important to keep mold in mind when these sorts of health effects are seen. If these health effects persist for a significant period of time, it may be wise to investigate the potential for mold growth being present in your home or workplace. Even if a flood hasn't occurred, mold may be present in a building. Water leaks into drywall and HVAC systems are common, unexpected occurrences where mold can grow and go unnoticed for a prolonged period of time. The people at the greatest risk of mold-related health effects are those individuals with allergies, asthma, sinusitis, and other lung diseases, or weakened immune systems such as HIV patients. Like with pollen and other airborne allergens, mold symptoms can manifest due to a mold allergy. The health effects that we have previously discussed are likely symptoms to be seen, which can make it difficult to conclude that an illness is due to mold. Asthma is defined as a chronic lung condition characterized by inflammation and narrowing of the airways or bronchi. When inhaled, mold spores can cause inflammation and the narrowing of the airways, which acts to exacerbate the breathing difficulties caused by asthma. Sinusitis and other lung diseases target the same pathways that mold does when it causes an infection in the respiratory system, restricting the airways and increasing difficulty breathing. Individuals with weakened immune systems are also at great risk of developing health complications stemming from mold. These individuals are generally more susceptible to all illnesses because their immune system is compromised, meaning it cannot effectively fight off contagions or infections. Immunocompromised people, or those caring for them, need to pay extra attention to the possibility of mold growth in places where they spend significant amounts of time because it may be an invisible yet serious aggressor. There are two ways that mold can be recognized. These are sight and smell. Mold usually appears as colored or woolly mats and often produces a foul, musty, earthy smell. Most people are likely familiar with patches of orange or black mold, like the mold shown in the background of this slide. It can sometimes also appear to grow in individual spots or colonies that come together to form a large mat. There are many mold species that may be found growing indoors, such as Cladosporium, Aspergillus, Penicillium, and Stachybotrys, otherwise known as black mold. All molds which are found growing in spaces where people are present should be promptly removed to prevent illnesses and exposure to potential molds. There are several good methods to prevent mold growth that target mold-prone areas before the spores can begin to grow into colonies. After water intrusion, begin by removing excess moisture with a wet, dry vacuum and dry out the building as quickly as possible. Fans can be used to assist in the drying process. Clean wet materials and surfaces with detergent and water and discard all water-damaged materials and all porous materials that have been wet for more than 48 hours. Again, the main cause of mold growth indoors is persistent dampness and a food source. So if dampness and high humidity can be eliminated, the chances of mold propagating are significantly diminished. These mold prevention practices should eliminate dampness that would allow mold to flourish. We have now discussed how to prevent mold growth from occurring, but it is not always the case that mold can be prevented from growing. It is also important to know general mold cleanup tips for those situations. The first steps to mold cleanup can be the same as the initial steps of preventing mold growth. Start by identifying and correcting the moisture problems by making sure the living or working area is well ventilated. Discard mold-damaged materials into plastic bags, use fans to assist in the drying process, and clean hard items and surfaces. To kill mold spores, mix 1 part bleach and 9 parts water into a clearly labeled container. Use this mixture to properly disinfect affected areas and materials. It is vital to remember to never mix bleach with any cleaning products that contain ammonia, as the mixture will off-gas, creating toxic vapors that can cause irritation, nausea, and even death. Here are some more mold general cleanup tips. Always use respiratory, hand, and eye protection. An N95 respirator is highly recommended. Goggles and mid-forearm length gloves should offer good protection from skin contact with mold or cleaning chemicals. If the cleaning area is large or the mold mats are significant, it would be wise to also use an impermeable coverall that protects more skin from being exposed. Re-wetting materials with a mist of water can suppress spores, dust, and debris from being kicked into the air during the cleaning process, minimizing exposure. Covering surfaces that could become contaminated is important so that spores aren't transferred to surfaces that are clean. Containing the mold will prevent issues from potentially becoming systemic through poor cleaning practices. Along with containment, vacuuming areas that are clean and dry with a HEPA or high-efficiency particulate air vacuum can prevent spores from getting established in other locations that didn't have mold. HEPA vacuums have a built-in filter that is capable of catching mold spores, preventing them from being spread across an area as the vacuum exhausts air. Finally, remember to never eat, drink, or smoke in areas where mold is being cleaned, as this is an easy vector for exposure to occur. Avoid breathing dusts, and after working, wash thoroughly, including hair, scalp, and nails. These parts of the body can be damp and harbor mold spores if not properly cleaned. The specific remediation tactics show how, in practice, someone should clean areas properly while minimizing exposure of mold to themselves and others. The purpose of this information is to emphasize the importance of keeping the size of the working area in mind for the sake of proper cleanup and limiting exposure. Different tactics may be used for areas of different size. It is important to create a detailed plan before beginning the cleanup process to ensure the containment needs of the situation are met. To begin, the work area and potentially the directly adjacent areas should be unoccupied. The larger the affected area, the more likely nearby areas need to be unoccupied as a precaution to limit exposure. It is recommended to remove individuals from the immediate area that are particularly susceptible to mold, such as infants and the elderly, those with allergies, asthma, sinusitis, or other respiratory diseases, and immunocompromised people. Again, always cover surfaces in the work area that are clean but could become otherwise contaminated by using secured plastic sheets. This one step can save time and effort down the road. As far as PPE, an individual who is cleaning mold should always wear non-vented goggles, gloves, and protective clothing such as a disposable coverall. At a minimum, use a NIOSH certified N, R, or P95 or higher particulate respirator. If remediation is expected to generate a lot of dust or visible concentration of mold is heavy, follow the extensive contamination protocols we will discuss on the next slide. The extensive and visible mold contamination protocols are more finely tuned for heavy mold removal or for business places which are directly responsible for the safety and well-being of their employees, who under designation may be tasked with the cleaning of mold contaminated surfaces. In these scenarios, it would be wise to develop a suitable mold remediation plan addressing work area isolation, the use of exhaust fans with HEPA filtration, and the design of airlocks or decontamination rooms. Since mold exposure is a significant health risk, we want to emphasize the proper PPE that should be used for anyone cleaning mold. Non-vented goggles, gloves, and disposable overalls should be used. Ensure that protective clothing covers the entire body, including the head and feet. For this level of heavy-duty cleaning, use, at a minimum, a NIOSH certified N, R, or P100 respirator. A half mask or full-face respirator may be needed in highly contaminated areas. Ensure those wearing respirators are medically able and are trained. You can and should consult with experienced health and safety professionals prior to this level of remediation. This has been the KY Safe webinar on mold awareness. Thank you for watching, and please continue to use our free e-training website at kysafe.ky.gov to aid in all of your health and safety training needs.